I just wanted to add to the comments about collaboration among different institutions and organizations. I think that's critical in this whole effort. And one of the examples I mentioned, the TPAC program, was a collaboration between DINEPA, the Haitian government institution, the Inter-American Development Bank, the World Bank, the CDC, and other partners as well, local municipalities, and also drawing in the private sector. These TPACs are going to be reporting data through SMS messaging. And this is a leapfrog technology. They're bypassing some of the more traditional ways of doing this, and they've been bringing in the cell phone providers to help not only provide the equipment, but potentially also help defray some of the cost. So this is another example where Haiti is probably going to be a model that we can use in other places as well. And it's a result of those collaborations among multiple different institutions.
So CDC has been involved for a very long time, one of the main partners along with several others. What's your kind of perspective looking back and looking ahead now? Knowing what you know now.
Well, I think Dr. Tournier made a good point that when Haiti first came to cholera, there was not the institutional knowledge to treat it in the clinicians. That's changed now. And that's not just a Haitian issue. That happens in other countries. It happens in developed countries sometimes when we have people coming back with malaria and they get misdiagnosed. So I think that, looking back, we see where there were gaps that have now been filled. And we will continue to work to fill those. And I think the national plan really provides the blueprint for how we move forward across the spectrum of addressing the entire spectrum of needs: water and sanitation, clinical issues, public health messaging, and health promotion.
Mm-hmm. Ellen, how do you bring in the science, the research, the programmatic aspects? How do you bring this into an audience today that's looking for policies moving forward?
So I think one of the things that we've tried to provide in support of the coalition and the plans is making them digestible for policymakers. I think that there is really great content that exists within those plans, and they're strong plans of action. And so how do you bring all of the different stakeholders together, building off of what was said earlier around collaboration and coordination that's needed, both within U.S. government agencies, but also externally within the implementing organizations and kind of the NGO world. How do you bring all of them together? And I think raising awareness through advocacy is one of those ways. And so working through partners on the ground to raise that awareness, anyone that we talk to, making sure that they're aware that the plans exist, and to help identify ways that they can work within those plans, as opposed to continuing maybe to do their own type of work, but how can they strengthen the work that they're doing based on the plan.
Mm-hmm. Dr. Tournier, one of the other pieces, we certainly understand the value of clean water, clean access, sanitation. What about the role of the vaccines?
Yeah, this has been, one of the big, I would say, nationally and maybe and even internationally, it's been a big, battle to let everybody understand that we don't believe that the vaccine in itself will prevent cholera, but it will be one of the pieces. So right now the government just finished to extend the vaccine in the north, but it's one of the comprehensive aspect that I was talking about. Give all the chances to those patient treatment, prevention, and the vaccine. This is a package, not itself, because we all know that the real treatment is access to clean water and potable. Mm-hmm. So this is one piece of the package.
Providing that safe, clean water from the get-go is going to prevent a lot of further problems later on. And one or more of you mentioned that the other diarrheal diseases and other sicknesses that can benefit from the sanitation. Rick, you want to just talk about that?
Yeah, we're not just talking about cholera, but other issues as well, diarrheal diseases like rotavirus or other diseases as well. And one of the things we saw after the cholera epidemic in Latin America in the 1990s was that improvements in water and sanitation led to decreases in those other diseases as well as the elimination of cholera in that region at the time. So in Mexico, for example, where municipal potable water was the level of provision of potable water went from, in the number of municipalities was increased significantly. The level of childhood diarrhea was also decreased at the same time. So water and sanitation provides numerous benefits. We're not just talking about solving the cholera issue, but really a larger public health problem. And I think to follow what Dr. Ternier said is really, just to echo what he said, these are complementary interventions. They're not competitive. As Dr. Etienne mentioned, the modeling results indicate that cholera vaccine plus water and sanitation averts the most cases. So it's not like we're talking about one or the other. These are complementary interventions.
Ellen?
One thing I just wanted to add was about the things beyond health also that water and sanitation provide to a country. I think economic growth that Dr. Etienne mentioned prior is a really key component. And I also think education. Right now there are issues with education all over the world, but water and sanitation provides the opportunity for girls to be in school, provides the opportunity for women who may have been hauling water to then spend their time with more productive activities. So I think it goes beyond, I think there's massive health impacts, and the cholera elimination is a key component of what we're trying to achieve. But I think, it's a ripple effect of what water and sanitation and hygiene can provide to a country.
I'm glad that you mentioned that, because we can get kind of caught up in the one particular aspect of a disease or a condition or a situation, and the economic benefits, the economic impact of health is something substantial that goes beyond what we could have ever really thought of. And when you're talking about girls being able to stay in school, mothers spending less time hauling water back and forth, and they can spend less time. We all know that every family wants to be healthy. Every parent wants to see their children thrive. Every parent wants to be in a community that's safe. Everybody wants the same thing. And health is the kind of the bottom line predictor for being able to, for making sure that we have all of that happen. And on a international global scale, when countries have more health, they have more economic opportunities, they're better partners with the rest of the world instead of being dependent. I mean, all of this all makes sense, and yet we have to kind of all make sure that we keep connecting the dots of health to better economic situations, to better economic partners in the world, and ultimately, certainly for Americans in Congress today, less dependence on the United States. Yet every country wants to be their own boss. They all want to be contributing. So I'm glad you brought that up.
I would just add too, there's an important community engagement aspect as well. When you, in addition to, the freed up time to attend school or to engage in other kinds of income generating activities, people who have that time are also able to be more invested in their communities. And, at the same time with, programs like the TEPAC program and others that, are employing people and having that kind of work take place at the community level, where there are opportunities for, community decision-making and political decision-making around water that involve the community, then that can ultimately extend participation and broader political processes as well.
And if countries can spend their less resources on trying to dig themselves out of a problem and be able to take those resources to developing their country, everybody's better off. So I'll just ask one more quick question and see if anybody has something in the audience. But Dr. Andrews is already singing.
For every dollar you invest in eliminating this syndrome, you save $13 in treatment costs. And that becomes a no-brainer for a minister of health, a minister of finance. So could you put that in perspective because there's similar data for this. It's in one of the articles you cite a study, and it's excellent. When you understand what a dollar investment provides, it becomes a no-brainer.
Yeah, there have been similar studies from WHO, the World Health Organization, looking at the benefit from investments in wash, water, sanitation, and hygiene, and they vary from something like $5 to $30 or $40 payoff per dollar invested. It depends on the intervention. It also depends on the context. In a place with low levels of service, the payoff would be more towards the higher end. So you're talking about a huge return on the investment. And that encompasses a lot of different factors, avoided treatment costs, like you mentioned, also some of the economic issues that Ellen mentioned. So did you want to?
I just wanted to add the World Bank, the Water and Sanitation Program of the World Bank has done a number of studies on the cost of inaction if you don't address sanitation, and globally we're talking billions and billions of dollars. And so I think, as Rick mentioned, there's a direct one to, somewhere between $5 and $38. But I think that you're talking about inaction and what is that actually going to cost in the long run? And I think that is they're impressive and disturbing numbers all at the same time, and we have the solutions, and we can do something about that now.
From the better integration of health economists with science policy and diplomatic policy and federal agencies, and all of that data will bring a much more full and complete picture for all of us, and provide better evidence for evidence-based policies, because everybody in this room wants to be doing what works.
Just a quick follow-up on that. I talked about the collaboration among agencies, but the collaboration among disciplines is also equally important. I'm an engineer. I work at a public health organization. We need different perspectives, including the ones you mentioned, health economists, but behavioral scientists as well. When we look at some of these issues around sanitation, for example, there are behavioral issues involved. We have to understand those before we go. We need to move forward. We need to move ahead at the same time, but it's not just a construction issue. There are other issues involved as well.
Any questions in the last few minutes? Oh, well, way in the back. Okay. Somebody with the gray, there you go. That's you.
So how is coordination going on now? How are you all trying to, operate in a coordinated way in the face of those obstacles? And how much coordination is there?
Well, I think there is a lot of coordination going on. This briefing is sponsored by the Coalition to Eliminate Cholera and Hispaniola, which is an international collaboration among 20 different organizations, all the ones represented here as well as other ones in the audience. There's ongoing coordination at the national level. The Ministry of Health is in the process of developing coordination mechanisms. More specifically, since the outbreak, there have been the cluster coordination mechanisms from the UN system, the WASH cluster, the health cluster. And so I think that's one of the things that's actually improved quite a bit. These are going to be ongoing efforts at coordination. In terms of US-based coordination, Chuck Chaitovitz, who's in the back there, if you could raise your hand, represents the US Water Partnership, which is a consortium of different US-based organizations that are to kind of reinforce U.S. participation, U.S. support of WASH initiatives. So there's various things going on. There's a lot still going on, and we can provide more information about that if you're interested.
Other question? Yes, sir.
We can see that for the cholera control program, cholera elimination program to succeed, there really needs to be close integration between the WASH people, which are dealing with preventive issues, and the health people, which are preventive with vaccines, and the curative with the cholera, the treatment centers, hospitals, and health centers. The record internationally is not good for national coordination. The Ministry of Health is not traditionally a coordinating body. And so my concern is, how do you enhance the coordination between DNEPA, which is not part of the Ministry of Health, but will probably have the bulk of responsibility for pushing the WASH program, with the Ministry of Health agencies, which will be doing the other aspects of the cholera control issue.
There's an opportunity to learn from colleagues and programs that are in government coordination that's happening in other places, and to bring those entities together. For example, in Uganda, there is an interagency coordination that's happening. And granted, it's not in the same exact situation, but I think that there's an opportunity for ministry officials from the Water and Environment Ministry there to help provide that expertise. So I think learning across countries is one potential opportunity for there to be the strengthening, and how does that trickle down within a country.
The highest leader of both governments have plans of action that have to be coordinated by a partnership. So as those plans of action get implemented with specific targets and indicators for monitoring progress, all the partners have to be sitting together to get it done effectively. So that will improve. And it has improved. Can we do better? Yes, and it will improve.
Well, I was going to say, from all of the comments today, what's clear is that the national plan, to me, I'd even call it a battle plan. A battle plan is really in place. It's already working. Can it work better? Yes. Can we do more? Yes. Can we have stronger capacity building efforts? Yes. But stuff that we do know has worked is working. We've made tremendous progress, and that progress will continue with the continued leadership of not only all of the various groups represented here, but also the behind-the-scenes liaisons and interactions that happen in the absence of formal coalition board meetings, and in continued U.S. leadership. So I want to thank all of the partners, the sponsors today for this briefing, and appreciate everyone's time. Speakers will all be here if you want to have comments afterwards, and next time you pick up that bottle of water, think twice.